So it is Diabetes Awareness Month in November. We're going to get aware, and we're also going to find out how to do something about it, maybe even how to prevent it. Karen Russell, Community Liaison for our Mountain Valley Regional Rehabilitation Hospital. Great to have you back with us, Karen.
Thank you. Yes, it's always a pleasure.
So what do we need to be aware of with diabetes?
Well, diabetes, the important thing is to first understand the use of insulin. So when we eat food, that food is converted into glucose, which enters the bloodstream.
Which is a sugar,
Which is a sugar, exactly.
Okay.
So once in the bloodstream, it tells our pancreas, okay, hey, we need some insulin, which is a hormone that helps transport that sugar out of the blood into our cells, which we use for energy. When you have some form of diabetes, then that mechanism has some issues. There's something wrong with it. It's not doing its job.
Interesting.
Yeah.
Because, you know, I have diabetic friends, and I mean, they can have serious problems if they don't get sugar either through, you know, a shot or insulin or something, or even just eating something with sugar, I guess.
Right. Well, there's two types of diabetes. There's type 1, which is generally juvenile onset. It's less rare. It's only 5% of diabetics that have that, but that's generally something you're born with, and that's where the pancreas produces little to no insulin. And then you have type 2, which is more common, and that's where generally the pancreas is giving you some insulin, but it's just your body is not converting it properly, so it's what's called insulin resistance. So it's just not doing the job as far as moving that blood sugar into the cells.
Oh, that is, and I think the juvenile diabetes is more severe oftentimes, is it?
It is, because you really are insulin dependent. Type 2, sometimes you can work with diet and exercise to control it, or use other medications. You're not necessarily using insulin. But type 1 diabetics, yeah, it's really important to control those blood sugars. That's when maybe you might need to eat more sugar, is because you can become hypoglycemic, where the blood sugars get too low. That can be extremely dangerous, or again, you can be hyperglycemic, where you've got too much blood sugar. So when you're type 1, that ability to keep those blood sugars stable is really challenging. It's a difficult
What do you see in terms of symptoms if people are not adjusted for whatever their diabetes is?
Yeah. Generally, you'll see things like increased thirst, increased urination, fatigue, sometimes tingling in the hands and the feet. A big one is wounds and cuts and things that are not healing, because diabetes affects the immune system. It also affects the body's ability to heal. Sometimes weight loss. Some of those are some of the key.
Oh yeah, and risk factors. What happens to people if it gets really bad? I think they have comas and even...
Yeah, the thing is, having high blood sugars is really, really hard on the body. So when you live your life with elevated blood sugars, it's really damaging to the system as a whole. People don't realize that it affects all of your organs in your body. It affects your eyes, it affects your kidneys, it can affect your heart. One of the biggest things we see are how much it affects the circulatory system and your nerves. So we see a lot of individuals with amputations because of the neuropathies and the things that happen in their lower extremities because of the diabetes.
Also, a lot of other health complications you might not think would be associated with diabetes.
Exactly, yeah. Again, those elevated blood sugars really play a lot of havoc on our systems, especially the arterial system. So when you think of the arterial system, if that's going to be affected, that's what supplies your whole body with all the nutrition and oxygen and everything that you require to live. So when that system is affected, it can affect, again, basically almost every part of your body.
Like the tingling, I didn't know about that. That's interesting. And I have an acquaintance whose husband lost his leg because he wasn't doing something vital. What do you do that helps diabetes besides your medications? What can people do to lessen the effects of that, or not get diabetes perhaps?
Yeah.
Even?
Well, I wanted to talk about your friend, because not necessarily that individual, the individual with diabetes, when they get that tingling and those neuropathies in their feet, they don't have that feeling in their feet. So they don't know that they might have a wound festering. They don't know they may have stepped on something. They can't feel it. So they might have something really serious going on in that foot. And then what happens is it festers and gets really infected.
Oh my gosh.
And then that's usually gets really past the point of no return, and that's when you start to get the amputations and things. So for those individuals, daily foot checks are so important in preventing some of those complications.
And don't go barefoot.
Don't exactly. We do. Yeah. What socks, what footwear you wear, and then not going not going without shoes and socks is so important.
Because you're not
for
going to
them.
feel if you step on something,
Exactly.
that's going to cause a wound or
Exactly.
Or wow.
Right.
Ooh. So exercise, diet, can people manage diabetes through that?
Yeah, often you can. If you're type 2, usually doctors will really start to kind of more manage with diet and exercise first and see if they can get that under control with proper nutrition, proper weight, because there is a link between obesity and being overweight and that insulin resistance that you develop. It's really hard for the insulin to get into the bloodstream to transport that sugar out of the blood. So there is a link between obesity and that insulin resistance. So they usually try to manage it with that. Exercise is also really good because it helps obviously with the weight management, but it also helps the body transport that sugar out of the blood into the cells. So it helps decrease that insulin resistance mechanism.
Wow, that's fascinating. What you were telling me off air too, which I thought was that when you carry your weight here, you're more susceptible to diabetes for
and
some
there
reason?
are some different things where you carry your weight. Can sometimes make you more susceptible. Genetics is actually a link to diabetes,
wow,
as well as certain ethnic groups. Hispanics and the Native American population are at a much higher risk of developing diabetes.
Okay, isn't that strange?
Yeah.
Just something in our DNA strands
Something in
or
your
whatever.
DNA that you cannot control, so you just have to really
Darn.
go into it with the utmost education in prevention.
Right. Now, at Mountain Valley Regional Rehab Hospital, what do you do over there in terms of treating diabetics with their complications and things?
Yeah, we have a whole team. So the first thing we're going to do is work with the nutritionist. The nutritionist is going to get with them and really talk about what they need to eat. Diabetics, really, it's more about having a good, healthy, balanced diet. It's not that they can't have any sugar or carbs, but it's balancing out and everything in moderation. Proteins generally are also encouraged because they help stabilize the blood sugar. So they're going to work with them on the proper diet for them. We also have nursing that's going to help them if they need to give themselves insulin. They're going to learn how to give themselves insulin, how to do their own blood sugar checks, because often you're going to have to check your blood sugars throughout the day. So you're going to have a nurse that's going to work with that education.
Because I know there are a lot of new methods that make it easier for diabetics to check that blood sugar every day too. And then I guess exercise, because there's a lot of therapy, physical therapy that you have.
Right.
At,
so therapy is going to work with them on how to manage their blood sugars with exercise, because that also can be a little tenuous because exercise lowers blood sugar. So you want to make sure that your blood sugars are at a level that if you exercise, you're not going to get hypoglycemic and cause a drop in the blood sugars that could be dangerous.
This is not easy.
It is not easy.
Wow.
It is not an easy,
I can see that there's a lot of knowledge, a lot of care and attention to what's going on if you're a diabetic.
Exactly, yeah.
And hopefully we can exercise and manage our diet and not get it if we're lucky. If we don't,
yeah, it really, it really just
depends.
the importance of diet and exercise, and avoiding those fast foods, avoiding the fatty diets, avoiding the high sugar diets, and again, it's just having a really good balanced diet. Eat things in moderation.
Good advice for all of us, but certainly for diabetics. Wow.
Definitely.
Karen Russell, Mountain Valley Regional Rehabilitation Hospital in Prescott Valley, all kinds of great services for all kinds of folks. Thanks so much for joining us.
Thank you.